Hello everyone, my name is Dr. Claudia Okeke from Awasio Incorporated in Rockville, Maryland. I'm here to do a recap on our series on cervical cancer. And this recap will be done in the form of questions and answers from our segments. So the first question is, why did Awasio Incorporated choose cervical cancer? Awasio chose cervical cancer for two reasons. One is the second most common cancer that affects women. The first most common cancer that affects women is breast cancer. And the second reason Awasio Incorporated chose cervical cancer is because cervical cancer is lifestyle based. Now the second question from the audience is, what causes cervical cancer? Cervical cancer is caused by a virus called human papilloma virus, HPV. Another question is, how does one contact this virus? This virus is contacted through sexual intercourse or sexual contact. Is it curable? Yes. If detected early, cervical cancer can be treated and can be cured from the system. How can we prevent cervical cancer? Cervical cancer can be prevented by doing HPV test, by also doing regular screening with pap smear. This will detect any abnormal cells in the body, and making sure that you avoid all the risk factors that are associated with getting cervical cancer. And then also by taking the vaccine, the HPV vaccine. As we mentioned in one of our segments, HPV vaccine is made, the HPV vaccines are made by two different companies, one by Merck and Company, and the other one, which is Cervarix, is made by GlaxoSmithKline. Gardasil, which is the other vaccine, is made by Merck and Company. Then the other question is, what are some of the risk factors and who are those at risk? Some of the risk factors include getting married at an early age, such as 13 years or older, and you get yourself exposed to the virus. The second, it affects people who are sexually active, and also women that have exposure to sex with men who have multiple partners. Then you have smokers, and you also have people that have HIV or people that have low immunity. These are the people that have risk of getting the cancer. Then the question is, what are the signs of cervical cancer? A lot of signs of cervical cancer will include bleeding, like you have intermenstrual bleeding, bleeding between menses, intermenopausal bleeding, bleeding during menopause, or even bleeding during sex, or even during very uncomfortable and painful sex. These are signs that something is wrong and we have to try to see the doctor. What are the suggestions for treatment of cervical cancer? Cervical cancer can be treated, of course, you have to discuss with your doctor and decide which ones you want to do. The first is surgery. There are two types. There is cryosurgery and also there is radical surgery. The second is by taking chemotherapy that for the period of time that is necessary. The third is radiation therapy. We hope that we have tried to address some of the issues that relate to cervical cancer and that can cause cervical cancer. And we hope you have also enjoyed our series on cervical cancer. We look forward to sharing other series with you. If you've liked this, please subscribe to our channel. Thank you.